and here is your question. Right, so if you have read and understood, considering which communication skills station, kindly please begin.
Hello, I am Dr. Khawar Rahman, one of the surgical doctor in this national hospital, and I'm working with Dr. Alexander, consultant general surgeon, who is the in charge of the case which I want to discuss with you. And sir, may I confirm that I am talking to hepatobiliary surgeon?
Yes, you are talking to Dr. Man, and I am a biliary surgeon. How
Are
may I
you
help
free,
you?
sir? Are you free, sir? Can I talk and discuss a case with the laparoscopic cholecystectomy patient?
Okay, go on.
Okay, sir, I want to summarize that 44-year-old Miss X has a laparoscopic cholecystectomy 4 days before, and she has uneventful recovery. But for 1 day, she developed pain, tachycardia, nausea, and and uh, and also the fever. And I examined her abdomen, that is lax. But we investigated her, and her lab shows elevated WBCs 18, and C-reactive protein is also high. Bilirubin is elevated, and ultrasound show there is a free fluid in the abdomen, but there is no CBD dilatation or intrahepatic duct dilatation. So, sir, we are suspecting that there is a some intraperitoneal bile, maybe some problem of the operation, which causes the bile accumulation in the abdomen. And so she needs a possible transfer to your hospital, sir.
Why you want to transfer, and what do you think the cause is? Where from fluid is coming?
Sir, we did the laparoscopic cholecystectomy, and we think that maybe there is a slippage of the ligature or clip that is slipped from the cystic duct. Maybe we have injured the common bile duct, and there are also possibilities that there may be accessory uh, cystic ducts which we may have missed. And other thing is that sometimes liver bed ooze with the bile. So these are the possibility that causes this bile accumulation. And we put the drain, and it causes the bile in the drain.
So you have to place the drain. So you have injured the CPD. Do you think that was the finding in trial?
Uh, Sir, I will investigate this case further by repeating the blood test, LFTs, and I will also do the. I will also advise the endoscopic retrograde cholangiopancreatography (ERCP) to confirm that either we have injured the CBD or possible
Okay.
stenting. But unfortunately, we do not have the ERCP facility.
Okay. Why TLC is increased and why there is rise in CRP?
It is due to infection, maybe patient towards peritonitis, biliary peritonitis, and that causes the inflammatory response, and patient has elevated total leukocyte count and CRP.
Okay, so what else you want to perform on this patient, and how you will manage for the timing in your hospital? How you
Sir,
are managing?
before shifting, I will shift this patient to high dependency unit. I will care this patient by the care of critical surgical patient, ABCDE approach. I will give IV fluids, antibiotics, and I have told you already that she needs repeated labs, which I will advise when I am off from the phone. And I have told you that I will advise the ERCP, which is this facility is not available in the hospital.
Okay, so
And
is
I
this
also check
is
the
this yes, sorry.
and I also check the drain, the how much drain is coming. Either it is increasing or decreasing until the patient is not shifted to your hospital, sir.
Okay, so this is this a serious case? You want to attend the case in the night when you will shoot the patient?
Yes, sir. I think
How
it
did
is her investigation and her symptom and signs like tachycardia, nausea, and elevated TLC revealed that she may go into biliary peritonitis, and it will be a serious condition that may be not reversible if early intervention is not done.
Okay. So, and who is accompanying this patient?
Sir, our anesthetist will accompany with this patient, or we can also accompany our surgical trainee with this case to accompany to your hospital.
Okay, and how you will transfer this patient?
First of all, I will coordinate with the bed manager of your hospital to check the bed availability, and then the patient can be transferred by road in the ambulance after checking the availability of the bed.
Okay, which type of ambulance you want? You will be requiring?
This ambulance is the in which care of critical surgical patient requirement is present. For example, IV fluids, oxygen, and the possible resuscitation like CPR may be there, but I don't think so that patient condition is so much deteriorating that she needs CPR, but only the oxygen and IV fluids is needed in this case.
Okay. Okay, you can transfer the patient.
Thank
You
you,
have
sir.
to still discuss that if there is no place available, you still have 1 minute left. So what
Okay.
would you do?
Okay, yes. I think our hospital is occupied with the critical patients, and while there is a waiting, what you will do in your hospital?
Meanwhile,
If there is no bed availability, then I will keep this patient in high dependency unit, and then I will monitor the drain that either it is uh, increasing or decreasing. If it is continuously increasing, then I have to operate with our consultant, and we will make and we will check where what is the
What
problem in
else?
it.
What else investigation and how what are the other parameters through which you can monitor the patients whether
I can
adequately treated or you are treating him adequately or not?
just I will do the lab investigation and blood CP,
Other
TLC,
than
C-reactive protein.
other than labs,
I
clinically.
can pass the CVP line
Mhm.
to monitor it,
Okay.
antibiotics, and I will ERCP facility is not available with us. So otherwise, ideally the ERCP. So
No,
in my hospital,
what single factor which controls the, you are saying the patient is in the sepsis, how you will monitoring whether patient is sepsis improving or not clinically, like there is a
I will do
pulse,
the
temperature, urine
sepsis
output.
6.
Yes.
Yes, sepsis 6 protocol, that is the uh, temperature, tachycardia. I will check urine output. I will give IV fluids, antibiotics,
Yes.
respiratory rate. Sepsis 6, I will follow the sepsis 6 protocol. And if in the last with the help of the consultant, we have to explore the case patient, and we will religate the suture, or if there is a rupture or damage to the CBD, we have to repair by ourselves. But we can do only the simple procedure. We cannot do the hepatobiliary anastomosis with the jejunum. hepatogenealogy, we can't do it.
Okay,
But simple procedure we can do with the help of our consultant, like CBD
okay,
and ostomosis with the jejunum or rent repair. These can be done in the
okay,
last. Or even we can place the drain, and drain will continue until the you have the bed availability, sir.
okay, thank you.
Thank you.
Madam, in the exam,
Yes.
in communication skill, he,
Yes, please.
the examiner go anywhere. He asks everything from morphine
Yes.
dose to anything. He can go
Anything,
anywhere.
anywhere, exactly. So how was you supposed to conclude this station? Have you concluded it accordingly?
Which case, madam? This case?
This one, yes, please.
I think.
Because here you only have to transfer the patient. And
Yes,
at the
madam.
end, yes, if your consultant says, all right, send your patient, then you can send it. So basically, but then here patient consultant can even ask you, when were the labs done? And when are you planning to do the labs again? Most of the things you have already asked, you've already discussed, but one or two which you forgot that, okay, if ultrasound was done and ERCP, all right, consultant will ask you what does it stand for and what's the
Actually,
purpose of it.
Dr.
Yes,
Dr. Howard was answering without, I didn't ask the question and he was telling all the things.
yes,
I think he should answer precisely
after
what's asked.
after
Because
being asked.
he may miss multiple questions what the examiner has to ask, I think.
Yes, this is the
Just
take
bit
home
by
lesson.
bit, deliver the information bit by bit, because there are multiple set of questions they have, and let's say I ask what's the cause, then you have to tell we think this is the cause. I think this is the cause. Then I will ask what else are the causes maybe. Then you have to answer the question, second question.
Yes,
Yes, it will increase the
yes,
number. Yes, you're
yes,
right.
yes, because that's when you'll get the chance to score. And one thing I have to tell you, they have the same 20 questions for all the 20 or 25 people who have to appear for that particular day, or the next day if they want to change. But what happens when they see a ship is sinking, then they let them sink. So then they can go anywhere. If they realize that the candidate knowledge is superficial, then they find that spot, that weak spot, and then they start tapping on that weak spot. That's how they make more and more candidates fail. So this is what you have to avoid. Don't let them find your weak spot. Good.
Okay.
Thank you.